Columbus Small Animal Hospital, loving our work. I'm Dr. Jim Kramer. This is Grace. She's a 12-year-old spayed female Bichon Poodle cross who was referred to us by another veterinarian for this obvious problem. This is a sudden onset of her hind legs not holding her up anymore. We refer to this as posterior paresis, and while it could be due to many things, the most common thing that we see is intervertebral disc disease. You can see that she cannot right either paw. We don't see anything that jumps out on these x-rays to tell us where the problem is. In this case, the owners believe that an object fell onto Grace's back and caused this injury. If the tissues around the spinal cord are bruised, they will swell, just like if you twist your ankle, and this puts inward pressure on the spinal cord. And the spinal cord is encased in bone, so it has nowhere to go, and it's like stepping on a garden hose. So the nerve pathways become interrupted between the brain and the hind legs, going both directions. Dr. Ann is a certified veterinary acupuncturist, and she uses what are called trigger points to locate the area of the problem if it doesn't show up on x-rays. So Grace is getting her class 4 therapeutic laser treatment, one of many, and now we're back in the Zen room with Dr. Ann with yet another acupuncture treatment. We treat these dogs with a barrage of modalities: intravenous treatment, oral medication, some holistic, and multiple acupuncture treatments with the acupunctoscope, which puts a small electric charge through the acupuncture needles, which potentiate their effect to upregulate or downregulate neuromuscular junctions. So here we are on day 2, and we can see that we're already getting some response. She can actually support her weight now and doesn't just melt down to the ground. She still has complete proprioceptive deficit there and cannot right that paw. Either she cannot feel that to know that it's upside down, or she knows it's upside down, but the motor nerves do not right it when the brain tells them to. You can see she actually did it once there, but she is able to support her weight, which is better than she was when she came in. So this is the 3rd day of treatment. We're outside today, trying to take a step, doesn't make it, but look at this. So walking crouchingly, which is far, far better than when she came in. We're starting to see some real progress. In addition to starting to be able to walk, she is also gaining some control of her tail. This is day 5 of treatment, and you can see that Grace is standing on her own. If you position her, she can stand, but still this proprioceptive deficit like before. Now it's been 14 days of treatment, and Grace is going home today. So during this time, this has become more obvious. The patch of hair that has been shaved from her back is where she was struck with an object, and a large abscess formed there. Some of the skin necrosed. In order for that to happen, that would have to be a substantial blow. Now 5 weeks have passed since Grace went home. You can see that her hair has grown back on that spot in the middle of her back, and it grew back in a different color, which does happen sometimes. So Grace has continued to gain strength and confidence on her way to a full recovery. A month has passed since the last video, and Grace has come back for another acupuncture treatment, and she's continuing to do very well. So here's Grace 4 months after she was referred to us for not being able to use her hind legs whatsoever following a back injury, and she's made a complete recovery. It took a lot of patience and persistence and effort, but it was worth it. She's going to have a great life. Columbus Small Animal Hospital, loving our work.